irrigation sometimes into the probe itself, the plasma probe. If we can incorporate a suction and irrigation, because the irrigation, why we need is for the plasma tool to work under water. It works with the water, with the saline. So we need a drop or two for the plasma probe to work, and we need mostly to control the bleedings. The bleeding points are very, very tiny, capillary. So 1 or 2 drops of plasma at the time of pressing the plasma probe, working at the time of plasma probe when we are touching. Then if we get 1 or 2 drops, that will be enough. If we can incorporate irrigation to the plasma probe, I just wonder whether it is possible, if they can work on that, so that we need not work underwater. So our idea is to get hemostasis, bleeding, to stop the bleeding while making the flap. So there, while making the incision, we get a very tiny spots of bleeding, very tiny bleeding. So there, if we can touch with the probe has to work with 1 or 2 drops. So the irrigation to the probe with 1 or 2 drops to make it work to stop the bleeding. That is good enough. So later, we don't need any underwater work, because underwater work, as we know, sometimes it will not be so clear for us. So is there any possibility to work on that? This is only a suggestion to our bonds company. They're really coming out.
I think we can. 侯主任就是，他的意思是说，考不考虑这个问题，就是，我们不需要盐水灌流，而是直接在
definitely work on that. Also to do that.
直接在刀头上，增加滴水，然后比如说滴2、3滴、2、3滴这样，不要快速的滴水，就需要去启动的时候就会滴水出来，然后就会能产生等离子能量，有足够的盐水产生等离子能量。然后也对应的有吸引，就是那个刀头上面有吸引，这样的话就不需要在盐水环境下面去工作了，就是直接就能解决这个出血的问题了。因为他感觉在盐水下面去工作的话，反而给他们觉得很不清楚，会让他们觉得很麻烦。所以他想就直接刀头上有盐水，有滴注，有吸引，然后来解决这个。出血止血的问题是不是有这种可能性
I think Dr. Mohan, so the suggestion you proposed, I think really nice way. We can try it. We can try it. If that is another way, is better than the OTO'VIEW plasma system. Maybe we don't know. We will try.
Yeah. Yes. We have to try. All the things are new. Yes.
I think I think we will get a way to figure out if that's a better way. Okay.
Yeah. Dr. Ho, I think I would like you to visit India too.
Okay. So if I get a chance, that's my pleasure.
Yeah.
I also want to get a chance to invite you to visit China and visit our hospital. I think Bounce Company will make it a go.
Yeah. In Beijing, which hospital is that? Which hospital? You are into which hospital?
Yes, I think we have to apply the visa.
Okay. Thank you. We'll make it.
Dr. Howe, a couple of questions for you. Like, I understood your concept of underwater working. So can we incorporate piezoelectric drill instead of doing the classical drilling? Because when you are already doing underwater, the piezoelectric drilling may be a new addition.
我没太听懂他说的什么意思。
就是他说的
there is a
就也那个
there are some otologic surgeons who use piezoelectric drill, which actually probably the idea taken from the dental people. So that's also worked underwater, and the drill stops as soon as it comes into contact with a soft tissue.
你帮我翻译一下，稍等。
他说
Hold on。
他说用那个模钻，就是刚才那个手术视频里面显示有用那个模钻的，模钻的他想是应该有不同种类的模钻是吧？他说我们现在有的模钻是类似于像在骨科里面那个牙科里面用的模钻，它碰到软组织的时候它就会停下不工作。
Okay, so I think I think during the operation, the kind of the drilling bore is a smooth drilling bore. It's not cutting. It's not coarse drilling bore. It's a smooth drilling bore. I think a smooth drilling bore is better because he can remove the bone, but he cannot stir a lot of the water, make the flap swing during in the water. So I recommended use the small drilling bore. You don't need to really big. I think 1.5 millimeter or 2 millimeters is better.
So as you showed that some of your institutes are doing study on this new equipment, you showed the centers and how many studies are going on. So have you checked that this technology, is it saving time, like you doing without the wand endoscopic ear surgery and with the wand, is it making a difference in the duration of surgery?
手术的就是我们做过那个调查，就是总结手术时间的长短，这个有比较过吗？
Yes, I think when we start this technology, we really design a couple of small trial to compare if we can shorter the operation time. I think we just for example, in terms of the cholestoma, during the conventional endoscopic ear surgery, we will consume the time about the 0.5 to 2.5 hours average. But after we use a plasma system, we can short 40 or 50 minutes. We can see
almost half.
Yes, yes.
It's
yes.
more than half.
Yes, more than
and
half.
that you are telling that shorter time of surgery definitely came after a learning curve, right? If we start doing it, will not come immediately. I hope it takes certain amount of time of training to work under the water.
就是他说这个学习曲线有多长？
I think
because I am more of microscopic and endoscopic. I do both. So for cholesteatoma, I do more microscopic. It gives me a faster, I finish faster. So probably we'll need little more hands-on and practicing to work under the water to achieve that shorter duration and to make benefit of the technology.
I think for the junior doctor, so I think all the junior doctors start the endoscopic ear surgery, they all have almost the same learning curve. But
Okay.
when they do the plasma technology system, they can learn more and more confidence. But for the learning curve, I think all the same. But for the senior doctors, they will get a really different experience. I think for they to perform the